What if a patient hands you a prescription, but something feels off? The dose is high, the drug interacts with something they mentioned in passing, and they look nervous. In the PEBC evaluating exam, these are exactly the judgment calls that separate a pass from a fail. Today we break down the patient care framework you need to ace pharmacy practice scenarios. Let's get into it. Before we dive into specific topics, you need to lock in the right mindset. The exam is not testing whether you've memorized every drug. It's testing whether you think like a pharmacist. In every scenario, ask yourself, what is the problem here? What information do I need? What should I do, and in what order? And critically, what could go wrong if I act too fast or not fast enough? Train your brain to run this loop automatically, and you'll find patient care questions much more manageable. One of the most powerful tools for patient care scenarios is a structured drug therapy problem list. When you read a case, mentally scan through these categories. Is this drug even needed? Is it the best choice for this patient? Is the dose appropriate for their age, weight, or organ function? And is the patient actually taking it and tolerating it? Examiners love to embed one or two of these problems inside a busy scenario to see if you can spot them under pressure. Practice flagging them by category every time you work through a case. Let's walk through a classic example. An elderly patient picks up their metformin refill, and a quick chart review shows a recent creatinine that's crept up. Your job is to recognize that metformin accumulates when kidney function declines, raising the risk of lactic acidosis, a rare but serious event. You'd calculate or reference the eGFR, apply your dose adjustment knowledge, communicate with the prescriber if a change is needed, and then counsel the patient. Notice the full loop: identify, assess, intervene, document, counsel. That's the pattern the exam rewards. One of the most common errors candidates make in patient care scenarios is treating allergy history as a binary yes or no. A patient who says they're allergic to penicillin needs more investigation, not an automatic refusal of a cephalosporin, and definitely not a silent override. What was the reaction? When did it happen? Was it a true IgE-mediated response or a side effect? The exam will test your ability to gather that information, weigh the clinical risk, and make an evidence-informed recommendation. Practice asking the right allergy follow-up questions until it's instinctive. Medication reconciliation scenarios show up frequently because they mirror real practice. A patient comes in post-hospitalization with a discharge med list. Your job is to compare it against what they were taking before and flag any discrepancies. Maybe a home medication was accidentally stopped. Maybe a new drug duplicates one they were already on. Maybe they started an herbal supplement that interacts with their warfarin. The exam tests whether you know to ask those extra questions, especially about over-the-counter products. Make reconciliation a full sweep habit, not a quick glance. When a patient walks up to the counter with a symptom, you need a structured approach, and Scholar Mac is your best friend. Walk through every letter. What exactly are their symptoms? What do they feel like? Have they had this before? When did it start? Where is it located? What makes it worse or better? Then layer in their medications, allergies, and existing conditions. This framework helps you triage. Is this something I can recommend a self-care product for? Or does this person need to see a physician today? The exam loves to test that triage decision, so practice making it deliberately. Under the current blueprint, health equity is an explicit part of what you're expected to demonstrate. That means recognizing that two patients with the same diagnosis may face very different barriers. A patient may not be refilling their inhaler because they can't afford it, not because they don't care. Someone with low health literacy may nod and smile during counseling without actually understanding the instructions. On exam scenarios, look for cues that a patient's social context is relevant and show that you adapt your approach, whether that's recommending a cheaper therapeutic alternative or using plain language and teach-back. Equity is clinical competence. Real patients rarely have just one problem, and neither do exam scenarios. You might be looking at a case with a potential drug interaction, a missed refill, a new symptom, and an affordability concern all at once. The skill being tested is prioritization. An acute safety risk, like a serious interaction or a sign of anaphylaxis, comes before a conversation about generic substitution. Train yourself to quickly rank problems. What threatens the patient right now, what affects long-term outcomes, and what can wait for a follow-up. Examiners want to see that logical hierarchy in your answers. Let's bring it together. Pharmacy practice patient care questions are won by candidates who have a repeatable system. You spot the drug therapy problem, you gather the right information, you prioritize the issues, you act, and you document. You don't skip the allergy history, you don't forget the OTCs, and you consider what barriers this individual patient might be facing. Build these habits now in practice questions, and they'll fire automatically on exam day. You've got this, now go put it into practice.